Hello, everyone. We will be discussing the different types of counseling therapies for the NCMHCE National Counseling Review for Mental Health. The first therapy we'll be discussing is cognitive behavioral therapy. It is a psychotherapeutic approach that addresses dysfunctional emotions, maladaptive behaviors, and cognitive processes and content through a number of goal-oriented, explicit, systematic procedures. Has been demonstrated to be effective for the treatment of a variety of conditions, including mood, anxiety, personality, eating, substance abuse, tic, and psychotic disorders. Rational emotive therapy, RET. Philosophy claims that people, to a large degree, consciously and unconsciously construct emotional difficulties such as self blame, self pity, clinical anger, hurt, guilt, shame, depression, and anxiety and behavior tendencies like procrastination, over compulsiveness, avoidance, addiction, and withdrawal by the means of their irrational and selfish behavior. Emoting and behaving. This therapy is then applied as an educational process in which the therapist often directively teaches the client how to identify irrational and self-defeating beliefs and philosophies, which in nature are rigid, extreme, unrealistic, illogical, and absolutist, and then to forcefully and actively question and dispute them and replace them with more rational and self-helping ones. Rational emotive therapy, RET, good for individuals, group, and family therapy, effective for problems including relationships, social skills, career changes, stress management, assertiveness training, grief, problems with aging, money, weight control, etc. Adlerian psychotherapy, one, theory and practice especially productive as applied to the growth and development of children. This therapy believes that a misbehaving child is a discouraged child and that helping children to feel valued, significant, and competent is often the most effective strategy in coping with difficult child behaviors. High need to feel a sense of belonging. Role of therapist is to facilitate expressing and accepting encouragement, respect, and social interest that helps us feel fulfilled and optimistic. Through the analysis of birth order, repeated coping patterns, and earliest memory, the psychotherapist infers the goal as a working hypothesis. Adlerian therapy. Two, individual psychotherapy, group therapy, couple therapy, and family therapy follow parallel paths. Clients are encouraged to overcome their feelings of insecurity, develop deeper feelings of connectedness, and to redirect their striving for significance into more socially beneficial directions. Through a respectful Socratic dialogue, they are challenged to correct mistaken assumptions, attitudes, behaviors, and feelings about themselves and the world. Constant encouragement stimulates clients to attempt what was believed impossible. The growth of confidence, pride, and gratification leads to a greater desire and ability to cooperate. The objective of therapy is to replace exaggerated self protection, self enhancement, and self indulgence with courageous social contribution. Existential psychotherapy. For high functioning clients, a goal of changing meaning, life review, discussion of beliefs, and development of spirituality. Adult counseling emphasizes self-responsibility and choices influenced by existential and Buddhism helps to resolve projections and unfinished business. For adults and teens who are being treated for substance abuse, addiction, behavior disorders, mood disorders, eating disorders, grief loss, trauma, sex addiction, compulsive gambling, bipolar, depression, and related conditions. Gestalt therapy techniques are empty chair, dream exploration, unfinished business, confrontation, as well as giving voice to physical limitations. Person-centered therapy promotes empathetic listening and understanding, extends unconditional positive regards to the client, important to build trust and rapport with clients to facilitate healing, helpful for increasing self-esteem, self-confidence, goal setting, and decision making. Humanistic therapy, person-centered, gestalt, existential, useful in treating substance abuse, eating disorders, trauma, post-traumatic stress disorder, weight management, pain management, sexual biofeedback description. Allows people to improve their health by reading their own body signals, reduces stress and anxiety, and increases self control. Trained professionals use biofeedback machines and a series of sensors to detect internal bodily functions, including brain activity, a process called neurofeedback, or EEG feedback, blood pressure, heart rate, skin temperature, respiration, muscle. Biofeedback is used for addiction, anxiety and depression, pain, ADHD, sleep disorders, emotional and behavioral disorders such as conduct disorder and bipolar disorder, migraine, high blood pressure, asthma, irregular heartbeat, digestive problems such as constipation and irritable bowel syndrome, autism, brain trauma, epilepsy, and stroke and paralysis. Art therapy. Expressive therapy can be beneficial in a wide range of cases, including addiction recovery, trauma recovery, grief loss treatment, sex addiction recovery, compulsive gambling recovery, and treatment for mental and emotional challenges such as depression, panic, and anxiety.